everyone, it's Danielle again. Today I am meeting with Mariah Tomason. Mariah is a speech language pathologist, and Mariah, can you tell us where you work and how long you've been working in this position?
Yes, so I am a speech language pathologist. I currently work for a company called Interface Rehab. They are a contract company, and so what they do is they supply physical therapists, occupational therapists, and speech language pathologists to skilled nursing homes. And I've been there for about a year so far.
And what got you interested in becoming a speech language pathologist? And is this something that you always wanted to do?
So actually, I did this because my mom told me to.
Which may be the case for some of you.
True story. So I was like 16, I thought I wanted to do psychiatry, and then I found out you had to go to school for 10 years, and I said, no way. And then my mom said, well, you should be a speech therapist. And I was like, eh. She goes, they have a good job market and they make a lot of money. And as a 16-year-old, I didn't care about that. I wanted to follow my passion in life. So I kind of, looked at a couple other options, but then I talked to a speech language pathologist, and I liked that you could work with adults, you could work with kids, you could work in schools, in a private setting, you work anywhere. So I thought, well, it works with people, which I like, and you're bound to find something that you enjoy doing, and you're not going to just be stuck doing the same thing forever. And so that's what got me into it. And so I went to San Diego State as a speech language pathology major. And it's actually pretty funny because my first year I just took the basics, the bio, the psychology, the history, things that had nothing to do with speech language pathology. But because I took so many AP classes in high school, it sped up my college course. And so then my second year, I found myself taking the prereqs for the major and the major core classes. So I had 5 straight classes of just speech language pathology. And so I was like, well, I guess I'm in this now. And so after the first semester, I thought, well, I didn't hate it. I mean, they were just basics too. But after my second semester, I really liked it because they got more into, what language is and how the brain connects to it and a little bit more advanced topics. And that's when I discovered that I really loved it.
All right, so you touched on the fact that first you went through undergraduate studies. What other steps did you have to go through in order to become a speech language pathologist?
So I had to complete an undergraduate program in speech language pathology or communication sciences and disorders. And then I had to go to grad school that was accredited by ASHA, which is our governing body. And so that was a process in itself. It required taking the GRE and, writing personal statements. And I applied all across the country. I really wanted to make sure I get in. Grad school does tend to be very competitive for this, field. So I was really concerned about getting in. And then once you you go to grad school, you have to get so many hours treating so many different kinds of disorders in your fieldwork. And then you take a praxis at the end, which is the test that lets you become a speech language pathologist. Once you graduate with your master's degree, you actually go through a period of 9 months called your clinical fellowship year, where you have a mentor who just kind of checks in on you. He has to do 8 hours of observation a month, and then after that you apply and then you get your license.
Now, you talked about the fact that grad school is very competitive. So what were things that you did or things that fellow peers did that helped them stand out during the grad school process?
Yes, so one of the biggest things was just having a really good GPA. In general, grad schools don't accept, for my field, they don't accept anything less than a 3.3. But the higher the better. I had friends who had decent GPAs, they had 3.4 and they didn't get in anywhere, and they applied multiple years, they applied all over the place. So having a good GPA was the first thing. The second thing was having experiences that set you apart. So I was a research assistant in a lab in undergrad, and a lot of people did that at San Diego State. So I thought that was something that everybody did. But I went to grad school and I found out nobody else had that experience. And so I think that really made a big difference for me.
And it sounds like the San Diego State program really helps their students to stand out.
Yes, it does. They encouraged a nature of competitiveness, almost in a bad way. They frequently reminded us that many of us would not get into grad school, which I guess is good because it set realistic expectations, but they were wrong. A lot of us did get into grad school. But it helped encourage us to always be the best so that we would actually be able to get in.
So now that you're in the field, what does your typical day look like?
So right now, since I'm at a skilled nursing facility, my typical day, I have to spend about 6.5 hours in treatment out of an 8-hour day. So they require what they call this 80% productivity. So I have to spend 80% of my time in direct patient contact. I screen all of the new admissions we get into the building who come in from the hospital. I see if they would require speech and languages services, and that includes anything from swallowing disorders to cognitive impairments, speech and language disorders, anything like that. And then so I review their chart, I go check them out, see how their eating and drinking are going, see if they're oriented, see if they kind of know what's going on, have any of their medical issues caused any sort of change in their function, and then I go from there. And then the rest of my time I spend with my currently developed caseload, so treating whatever people I have. So that might be meals, trialing for diet upgrades, so harder consistencies of food, or seeing if maybe they're more appropriate for something like thickened liquids. For my cognitive patients, we'll do anything from working on their memory skills to practicing managing their medicines. So anything from building up the neuroplasticity to really functional activities.
Now, you touched on this, the fact that there are many disorders within speech and language. Can you talk about maybe one that you particularly like to treat?
I really enjoy higher level cognitive processes. So people who have some cognitive impairments but are still pretty functional, but who just find deficits from where they used to be. So whether that's in memory, their ability to, prepare and plan meals and go grocery shopping for those things. So I really like to work on those. They're a little bit more of a challenge for me. And also those people are usually very motivated to work on things, which is very exciting to see.
Yeah. Now, you talked about the fact that you do contract work. Can you maybe tell the students what exactly that means, and maybe some pros that come with it and some challenges that come with that type of work as well?
Yes, so I work for a contract company, which means we are not employed by the building we work in. It definitely has its pros and cons. One of the pros is that I can go all over the place. So if I have a short day, I can go somewhere else to make up those hours, which is really nice because my company contracts a lot of buildings nearby. One of the cons is that sometimes it causes some rifts between the therapists and the nursing staff. A lot of times they'll say things like, oh, it's because you're not with our building or because you're not with our company. But I've seen buildings that don't care about that either. So it really just depends on the building for that. The other con is actually right now on October 1st, they're going through some Medicare changes and they're switching from PPS to PDPM, just insurance stuff. But a lot of places are panicking and they're getting rid of contract companies and then either trying to hire back the therapists as in-house. And so just kind of depending on where the pendulum is swinging with insurance at the moment, contract companies are either thriving or suffering. And so right now, because they're going through a transition, a lot of places are freaking out and either getting rid of their contract companies or they're trying to have more of it. And so it just means that there's a lot of stuff that goes up in the air when changes occur in healthcare.
Now, do you think that newer grads are more likely to find themselves working for a contract company at first, or does it just depend?
It really depends. I think a lot of it depends where you live. Okay. So I probably could have found a job with a non-contract company had I looked a little bit harder, but they do provide a lot of employment opportunities. So there's that. My friends in Milwaukee, where I went to grad school, they were all struggling to find jobs if they wanted to work in the medical field because Milwaukee's a pretty small city. I mean, it's big, but it's small. And they only have a couple hospitals, and they had 2 grad programs that were putting out 25 new speech language pathologists every year. And not that many speech language pathologists are leaving the city. So they had better luck with contract companies, and some of them were even lucky to get into skilled nursing facilities. But they also have them for schools, so I don't know, it just kind of depends. I think a lot of it's where you live, a lot of it's what you're looking for. You might be better off with it, but I think sometimes people in contract companies are not as happy as people who are employed by in-house companies. Yeah.
Now, what was something that you had to learn as you were working that school didn't prepare you for?
So many things. The biggest one, especially being in a skilled nursing facility, was this motivation aspect. So I found this especially in the first couple buildings I was at, more so than the building I'm working at right now.
Which you mean patient motivation?
Yes, patient motivation. Oh my gosh, but just trying to get them to participate or want to do things, you know, and because skilled nursing facilities are a mix of long-term and short-term patients, so people who are short-term are much more likely to be motivated to do things versus people who have lived there for 6 to 8 years, maybe go out to the hospital, come back, need therapy, or like, I've lived here forever, I do not want to do therapy. So I would have to trick them into doing it with me. Nobody ever talked about that. And then just politics, like you hear about the politics that happen, but you don't really understand until you're in that situation.
Yeah, it's interesting. Actually, if you remember, our physician also talked about the whole politics factor that school doesn't prepare you for, but that you get immersed in as you begin to work.
Yeah. I never thought I would have to fight for like the ethics of my field and you know, this patient's not appropriate, they do not need speech therapy, and they want me to keep them on anyway for money purposes.
Insurance.
Yeah.
Yeah.
And so, you know, there's a fine line between, well, I'm employed by this company and they need to make money so that they keep me on, but also like that's not appropriate, and you know, what do you do?
Yeah, totally. And you guys might face this one day too, once you're in your careers, the whole ethical concept, what Mariah was just talking about, especially when it comes to insurance, because you'll see that a lot, especially in skilled nursing facilities. Now, we're almost finished, but what is one final piece of advice that you would have for any of our students who are looking to become speech language pathologists?
Just work your butt off. I mean, it's so worth it in the end. School is really hard, but you just really have to push. You have to make sacrifices to make sure you get good grades. And it's pretty rough while you're in school. You know, that's 6 years of a lot of time and effort you're committing to, but it's so worth it in the end. Speech language pathology is such a good field. You're so needed. So, I mean, just making those sacrifices to make sure that you can get into grad school. And once you're into grad school, it gets a lot easier because now they're like on your side and like rooting for you to do well too. But yeah, just pushing through and making those little sacrifices to make sure you do your best that you can.
Well, Mariah, thank you so much for sitting down with me.
Thanks for having me.
And sharing a little bit about yourself and speech language pathology in general. For everyone else, thank you so much for listening. And until next time, take care.